Before coming to corneal scar, we have to know something about cornea. Actually, eyeball is made up of 3 layers, everybody knows. Is fibrous layer, then vascular layer, then nervous layer. And cornea is the anteriormost part of the fibrous layer, that is the external layer. And this is especially made for transmission of the light rays from the external surface into the eyeball. So, there should be some very characteristic features for cornea to perform this function. These are mainly transparency. So, second function of this cornea is to deviate the light rays so as to focus on a particular point inside the eye. That property everybody knows, it is refraction. So, cornea has these two main functions. One is transmit the light rays from the object to the eyeball, inside the eyeball. Second is refract the light rays so as to converge on a particular point. So, for this, the main property of the cornea is, one is transparency. Only if the surface is transparent, light rays will be entering inside or transmitted through. And second is, one is the curvature of the cornea. Curvature is very important in the action of refraction. So, when these properties are touched, become defective, it becomes a disease. Now, coming to corneal scar. Corneal scar means it is an opacity to the cornea. Then it is very clear that if there is a scar on cornea, it will affect the vision. So, it is responsible for the visual defects, then becomes a serious issue. And in the case of corneal scar, we have to understand the position of the scar and the depth of the scar, both are equally important. And if the scar is central, it is more serious. That means behind the cornea there is another layer, that is iris, and it is dark in color. There is so many reasons why it is dark. I am not coming to that aspect, scientific aspects, but this iris, that is known as iris, in the center of this iris there is a small hole, that is known as pupil, and through this pupil the light rays are transmitted. And the light rays passes through this hole only, not through the iris. So, the central part of the cornea is more important. If that area is affected by the scar, vision will be highly affected. And if the scar is only peripheral area, on the peripheral area of the cornea, vision will not be affected. That patient is lucky. That is only a term we can say. That is one thing. So, if there is a scar, it should be in the peripheral, then vision will not be affected. If it is in the central area, it will be highly affected. And other thing is, we have already told the curvature of the cornea. If there is any disparity or any defect in the smoothness of the cornea as a result of the scar, then refraction will be affected. There will be some astigmatism or that type of changes because of this defect in the curvature or smoothness of this corneal surface. So, these two things are the considerable factors in the case of opacity or corneal scar. And usually this happens as a result of corneal ulcer or any lesions on the cornea. Because to keep the transparency, there is a particular features, physiology, that is, there is no blood supply directly to the cornea. And this nutrition which is maintained by this vascularity or blood vessels is maintained or performed in the cornea by some other methods. That is by aqueous humour, and which that aqueous humour is actually filtered from the cornea and these blood vessels itself, and that fluid and also the atmospheric oxygen come together, maintains the nutrition of the cornea. That means if there is any defect in these two factors, then also the scar may develop. So, if there is a lesion in the cornea, there is necessity of blood supply for healing purpose. Since there is no blood supply in cornea, what happens? The blood vessels from the peripheral side of the cornea will encroach to that lesion to get it healed. And after healing that ulcer, it will disappear, it will be vanished or absorbed by itself. If it persists, that also makes opacity or a scar. And if normal healing itself, there is a possibility of developing scar, because that cells of the affected area will be discarded, and some tissues, some cells will be deposited to maintain the surface, to make it smooth and normal. So, that cells will be opaque, more fibrous in nature. That is why the scar is developed. Usually the scar, that means corneal scar, is developed after healing an ulcer or a wound or a trauma, whatever it may be. So, before starting the treatment of scar, we have to confirm twice or thrice that the inflammation is completely healed. There is no more points to be considered about inflammation, because the treatment of that inflammation or the ulcerative stage is entirely different from that of the treatment in a scar stage or an opaque stage. Because in first stage, we have to consider the healing property. In Ayurveda, that is pitta dominant. So, we have to select the drugs and the treatment procedures to heal or to subside the dominance of pitta, and especially having the property of, in Ayurveda we will say robana, that means healing. So, the drugs and treatment procedures will be for this purpose. And when it is changing to the scar stage, that is opaque stage, then Kaba comes to the picture. It will be more shodhana in nature or leghana in nature. That means to drain out the deposit. That means in the scar development, it is already seen that a deposit of unwanted cells or abnormal cells. So, we have to discard that, we have to drain out that things and to bring new cells, the transparent cells. Then the treatment will be different from that of the previous stage. Here Kaba Shamana treatment is more important, to scrape it or to dissolve it and to drain out, that type of treatment procedures. For that, usually in Ayurveda use Anjana treatment. Anjana means there are different types of Anjanas, Robana Anjana, Shodhana Anjana, Leghana Anjana, like that. So, these are to drain out the deposits and make it clean and make it bring to a normal stage. That type of medicines and treatments are necessary. When select these drugs, one should be very careful. So, there is one term in Ayurveda, that is Chakshushya. That means which is effective in the ocular tissue. There are a group of drugs or raw materials which is effective, that means which works properly in the ocular system, the cells, tissues and cells of the ophthalmic. So, that type of medicine should be selected for the treatment of generally all eye disease. Here we have to satisfy three aspects. One is, it should be having the properties of Chakshushya, and it should have the properties of Kabashamana, it should have the properties of Leghna or Shodhana also. If these three things are satisfied in the selection of drugs, and if you are using it in the proper way, then treatment will be successful. Along with the external treatment procedures, there are highly effective oral medications also, oral medicines also for the treatment of corneal scar. Because Kabashamana or Kabashodhana type of medicines are there in Ayurveda. So, a combined action of these oral medicines and also the external treatment procedures, the treatment will be highly successful.